Well, goodness gosh, despite a kind of 50-year track safety record, there's so many misconceptions about sweeteners. I've seen them lots, both in my capacity as a dietitian and also a spokesperson for the British Dietetic Association. And many of them centre around kind of safety. Do they cause cancer? Appetite? Are they going to make you feel more hungry or weight and things like that? Are they going to make you fatter? And then obviously over the past year, we've learned more about gut health, and we're wondering whether or not sweeteners, people say, well, sweeteners, they're going to affect our gut microbiota and affect the diversity of our gut microbiota. Other things people say is I can only have 2 cans of Coke a day and that's all that I'm allowed to have, a safe amount. Or aspartame's the worst of all the sweeteners. So there's a lot of misconceptions out there, and there's a lot of myths that need busting. Absolutely. Sweeteners are one of the most thoroughly researched ingredients in the world, and there's a huge, strong scientific evidence base that shows that they are completely safe. After all sweeteners in the EU have to undergo a rigorous safety assessment by the European Food Safety Authority before they're allowed into foods and drinks in the UK and Europe. And they also have to have a proven benefit for a consumer before they're actually added to the list of approved sweeteners. And even further down the line, they are constantly reattested and reevaluated to continue to make sure that they're actually safe. I think one of the interesting things is a lot of all additives and sweeteners get an E number, but consumers are really confused about E numbers. A lot of them think of them as kind of bad for us, but actually the E number is a marker of safety. So this is something I think we should be getting out there. Well, for me as a dietitian, I just think it's really important that we're kind of reaffirming the safety, reaffirming the decades of safety and the fact that they are completely safe. They are one of the most rigorously tested ingredients, as I've just, mentioned. And I think what worries me as a dietitian is that there's a lot of the press that gets kind of, we talk about, often like the poorer quality studies. So what I would really like to see is the kind of experts actually commenting on the studies that actually make the way into the media, make sure they're properly evaluated by experts like ourselves, look at the totality of the evidence base and make sure we look at the limitations of the study. Are they done on animals? Are they an observational study? And therefore kind of dampening down all the misconceptions that we're actually getting. Yeah, ADI stands for acceptable daily intake, and basically it's an estimation of the amount per kilogram of body weight that you can safely consume of sweeteners every day throughout your entire lifetime without any risk to health. And the ADI has actually 100-fold safety margin actually inbuilt. So even if you had sweeteners every day, you'd be very difficult to actually reach that ADI. But you're not alone. Even amongst fellow dietitians, I think it's only 19% of people would know what actual ADI actually stands for. So when you get down to consumers, most people have never actually even heard of ADI. But for me, it actually is a marker of safety. And I think because people don't know about it, it's good to put it into context. And I always like visual things. So when we think of, for example, the ADI for something like the stevia, the ADI is kind of 0.4 milligrams per kilogram body weight per day. But to put that into context and make it quite visual, a consumer would have to consume kind of 9 cans, 330 ml cans every day for their whole lifetime to be at risk. So it just puts it into context, really.